My name is Dr. Joseph Sokhn. I was born in Beirut, Lebanon. Since I was a child, I always wanted to be a cancer doctor. I didn't really understand what it meant at that point, but I felt it was kind of a calling for me. I went to urology and surgical training, and I liked the oncology part of that. And when I came to the States, I went to do internal medicine. I work as faculty in internal medicine, and then I did my fellowship to that. I graduated in 2017. I did it in New Haven, Connecticut, at Yale New Haven Hospital. My specialty is hematology and oncology. Hematology is we take care of benign hematology conditions like anemia, platelets problems, and bleeding issues. And we take care of the malignancies, whether it is related to blood cancers or solid tumor cancers. I believe that my patient is a human being, and even when they are sick, I don't think they just want to focus on their disease. They're not a sick patient, they are a human being. And getting to know them and taking the stress out of their life as much as I can is very helpful to them. It's also very helpful for me. People always ask me, how can I do this job and enjoy it? It's not about enjoying the stress or the pain of what we go through, but the patient is a patient and they're precious. And getting to know them, this is what gives me pleasure and makes my job worth it. And the family also, of course, is always a plus to get to know them too. I feel I relate to the patients on a personal level. They usually comment on compassion. They comment on being personable. And I always try to do to the patient the way I would like to be treated myself. And I love my patients and I love my work, and that's key to making me happy. And I feel like, someone said before, if you care about the patient, if you care about what you do, then you will provide good care. Or the secret to good care is to care. One of my patients had a heart failure and blood pressure, and he asked me, do you help me with the blood pressure thing? I said, yeah, I will do. I said, it's not my specialty, but my specialty is you. And I said, you know what, that's the specialty, that's kind of what the hospital is about, because it's not about what we know. We don't treat the disease, we treat the patient. I'm interested in immunotherapy, targeted therapy, and one of the benefits of chemotherapy-free regimens is they're very well tolerated. Now we look into a specific mutation, we call it driver mutation, and we try to target this mutation and suppress the cancer. I work actually in pioneers in that area, and people who have discovered a lot of the early regimens, like targeting EGFR mutations in lung cancer. I work with a person who published the first article in 2004 about it. The other very important things in oncology nowadays is immunotherapy. So immunotherapy actually fulfills the dream in many ways of an oncologist, is to cure the cancer. So in oncology, we are very careful to speak about cure. But in many cases, what we can achieve, the closest thing we can achieve to cure is called durable response. So you have a patient with melanoma, you give them immunotherapy. I had one of my patients, he had cancer really everywhere. It was in the lung, in the brain, in the bones, and he got immunotherapy. His scans, it's been 2 years, his scans have showed complete response. And the patients always ask about chemotherapy, is it really worth it or not? And the question always becomes, you put things in balance. And if you have on one side, you have the cancer with its side effects, and you have the chemotherapy with its side effects. And then you have to weigh which one is gonna give you more benefit, even if it's chemotherapy, the regular one. And in many cases, actually, although chemotherapy is not a good thing it's not easy, but in many cases, it's easier than the cancer by itself. So that's why we call it palliative chemotherapy or palliative treatment, because even though we may not be able to cure the cancer, we can make a difference in the patient's life. And this is really what's important.